and anything that they have in the back of their mind that may be an issue. A lot of the times, these physicals are either done at urgent cares or walk-in clinics. The problem with that is they don't get to see the doctors so many times, and they clear them very quickly and immediately. It depends on what the process is, and now if it's from a school perspective, it means having a regular doctor that they see, and they'll be able to be around them. It could even be myself, to be able to screen them appropriately and to be able to take the time, because a lot of times it's just getting that piece of paper, because all that athlete wants to do is play for that season and get it cleared. But if it takes a little bit longer for them to be able to talk to a physician or a healthcare provider to address any issues and concerns, and then on a case-by-case basis be able to see whatever they can do to help them out.
Going back to the inhalers, I've seen it, I've heard about it, and I've seen it a lot of times, like if kids having chest pains is related to asthma, and they'll just borrow their buddy's inhaler. What would be the problems with, a problem with them using like their friend's inhaler, even though it could be the same prescription as like ProAir or Ventolin? I've just heard that a lot. So
I don't know if I should be recorded saying this, but I don't. I mean, technically, there's no problem with using another kid's inhaler. It's the same exact medication. The reason people say that is, is really more to protect themselves from any issue. But, my Vicodin and the albuterol, your antibiotic, Zithromax, is the same, regardless of whose name is on it. It's just more of a safety issue.
And it might be, too, there's the people that say, well, I have a prescription. I see you're having a hard time breathing. Here's my inhaler.
That's exactly what I've seen usually.
Yeah, and I think then it's a whole different issue. Is what do you have any problems with steroids or all this? But
Right.
yeah, I from what I've seen is I forgot my inhaler today. You have the same medicine. Can I have a shot of yours? Is
Right.
one thing, but another is, or I've got some, I don't know what's a prescription with a lot of potential side effects, but I'm just throwing out something out. Here's some Celebrex.
Right.
Your shoulder's hurting here's or an antibiotic because you have a cough or whatever. I think that's more of the bigger issue.
Right.
And then obviously the teen abuse of prescription drugs is coming out now, but
Sure.
inhaler is probably the least of their concerns, I would think. So,
Right.
but it's definitely a problem in high school, especially because the kids are naive to that kind of stuff. It's like,
Right.
oh well, here, nobody's gonna know. Here, take a shot of this or whatever, and
Well, we
I think it's a
see
problem.
a lot of that in high school, because what ends up happening is that kids give each other pills, and it may be Xanax or something, and they show up in the emergency room gorked, and everyone's trying to figure out, what did this person take? A few years back, there was these smoke shops that popped up, and people were smoking this Kush, and so that's what I worry about more so in the teenage group than sharing an inhaler. That's pretty minor.
And they probably won't tell you what they took because they're afraid to get in trouble.
Exactly.
Yeah.
All right, so as you were saying before, it has to come up. You're headed to Dallas today, Dr. Allenye. And one of my students said, don't bring it back with you. So talking about emergency medicine, we actually had a student with the type of meningitis in the last few weeks. So he was in the hospital, and they had to come in and do all this fogging of the locker rooms, that kind of thing. So Dr. Allenye, talk about those type of emergencies where it's more of a cold or bacteria or virus type thing rather than an orthopedic type injury.
Well, I think anytime there's what we consider a communicable disease, whether that be, influenza or flu or, just your standard upper respiratory virus, a lot of it is really just about using common sense. If someone around you is sick, make sure that, you wash your hands and you just, don't share the same glass. If you're the person who's sick, cover your cough. You've seen those posters. If you blow your nose and throw the tissue out and then you touch the doorknob handle, just be mindful. Maybe you should wipe it down so you're not transferring anything, to anyone else. A lot of the reason that people, like there's a flu outbreak is really just because people live in close quarters and sometimes their hygiene is not the best in terms of preventing, these diseases from transferring from one person to another. even in the healthcare setting, why a lot of people get infections in the hospital is really because I, as a doctor, may see one patient, and then I leave the room, I don't wash my hands, and then I go in and I go see another patient. And so now what ends up happening is that that patient had, influenza, and I have now transferred that maybe to this other patient through, my poor hygiene. And I think doctors and nurses are very guilty of this just because we get exposed to so many things. Our immune systems are very strong. It's very difficult to find a doctor who's out sick or a nurse who's out sick because we've been exposed to so many things over the years. Our immune systems are turbocharged. And so, but that doesn't necessarily, it's not necessarily the same thing for our patients. And so I would just say, like, when you had that meningitis outbreak in the school, or for that one person that had it, as long as the other people around that person were not, that he didn't sneeze or cough on them, it's highly unlikely that they would ever catch anything.
All right. So, Dr. Lee, any other?
On top of that, I mean, we're dealing with, from an athletic population or school population, like you said, are in such close quarters. Now, they're even closer in the locker room.
Mm-hmm.
Okay. So, we worry about towels. We worry about even skin infections and things like that. And then a lot of student athletes won't realize, but depending on the sport that they're playing, they may be ineligible because they may be able to transfer whatever infection they have to another person that they may be in contact with. So, it's just a lot of things just has to be, when it comes down to education, and at this point in time, a lot of who's here is you. And they have to be able to come up to you and be able to be honest with what's going on with any symptoms of anything, and not take it too lightly. And if that means calling a doctor in to have him checked out, then so be it. So, but I wouldn't hide and have them be in fear of not being honest with what's going on with any of their symptoms and how they're feeling, for that matter. And it could be both, not only other than a medical illness, it could even be a psychological thing too. There could be other things going on too. So you're the forefront.
Awesome. Nick, you look like you have a question. Do you have something?
Oh, no, I wasn't.
So I have Dr. Lee, this may be more for you, but one of the things we have to do, we have to teach, and the students have to do in my class is an emergency action plan.
Mm-hmm.
Do you, in your experience, is there any, everybody knows how to do it, what to do, but in your practical experience, do you see anything that you wish more athletic training sites or staffs would do, or failures or where there's a break in the chain that that you've noticed consistently that people need to think about for an emergency situation, or is it, or on the other side, has it been pretty smooth for you?
I think it just depends on everyone's training and where they've trained at, and it comes to being prepared. Now, where I trained, my fellowship was at a NC2A1 school, and everything was laid out, and there actually are handbooks and guidelines. So even though you may have been trained and have gone through the drills, if it's actually written out, because sometimes in the chaos of everything, you may just want to read a script. At least it's standardized, and you know what you're going to do. But you need to know who your players and who's involved as far as doing what. Now that can change on an everyday level as far as who's covering what, or from an athletic training perspective, a physician level, who's in charge of the building, for example. It comes down to even where's the ambulance going to come in, which entrance, which door, evacuation routes. There's so many different things. So if it's, yes, there may be something set in stone that we know about it, but if it's actually in a book somewhere and everyone knows where it is, and it's a step-by-step process, and that seems to be the most helpful that I've seen where I trained at, because usually when it comes to these action plans, they're done maybe once at the beginning of the season, and that's it, and that's what you're going to rely on. But at least one is better than none, but hopefully you never have to put that action plan in place. And when it does, you want to make sure you have a guideline as to what to do. So for me, that's what I've seen. Now, it may be different from an institution by institution basis, but in general, that seems to be pretty clear.
I'm good.
Okay, so two last things. Well, you kind of talked about it with the students, and students always love to hear horror stories, and the one about maggots crawling out of wounds is pretty gross. Like, I mean, it sounds like just CSI type stuff, something you just see on TV, but I guess that's really where they get it from. Now, do you normally see very many athletes in the Neighbors Emergency Center?
Yes, because of the heightened awareness about concussions, especially during football season, we see people coming in for CAT scans of the head. Basically, when someone hits their head in a football game or any other injury, they show up and they get a picture of their head. It's not really to make sure that do they have a concussion or not. It's really, is there anything more serious going on? Have you suffered a skull fracture? Do you have bleeding around your brain? And so, because those are actually a little bit more life-threatening. For example, there was Liam Neeson's wife. When she was skiing, she fell down and hit her head. She kind of ignored it, and it was too late by the time they showed up for medical care because she was having bleeding in her brain. So that's really the primary reason why you get a CAT scan after you suffer a head injury, is to make sure none of the blood vessels in the brain were torn, and now you're bleeding internally and just don't know it.
See, that scares me because I'm a parent. I have 2 young boys and 1 on the way. And I mean, falling is part of what they do. Right. So it's like, well, do I need to take them to the emergency room every time? You know, I mean, obviously we're going back to athletic training, but man, I mean, just with the stuff we know, I mean, this is the same stuff that I did when I was a kid, and I never went to the hospital, but
I can relate. My youngest, she was 8 months, I think, fell out of her crib, and I was the only one home. And my first thought was, got to go to the ER. And I just sat and I watched her. And the worst part is, it's stupid me. After she was fine, I stayed with her a good hour. I mean, I got on the internet, and that's the worst thing you can do. And child falls out of crib, and there's message boards, and it was, what kind of idiot are you? How could you not take your kid to the ER, and just things like that. I calm myself as I use my training. She's fine. She's responding. And knowing your kid, obviously, she has the same personality. And she was fine, but the worst thing I did was I double checked what do they do on the internet? What do they say to do on the internet? And you felt like the worst parent in the world because of what you said. Obviously this is more than just a fall, but it was that situation. But I know exactly what you mean. It's when you decide, fell and bumped their head on a sharp corner versus they fell and their head kind of barely touched the floor. But yeah, it's different when you're a parent too. And our program coordinator, Dr. Yellen, he made the comment when his kid had something like that. He's like, take them. You're the pros, because the emotions are completely different when it's your own kid versus when it's your athlete, or when it's a stranger walks in the room and something really bad is going on. You're still calm because there's no emotional connection. But definitely a situation's higher level when it's your own kid or your own family member, I think.
I always tell parents when they come in, because some parents just want to be reassured when they come in, when their kid falls and hits their head, and they don't necessarily want a CAT scan, but they just want my opinion. And I always tell parents, just very globally, when a child hits the front of their head, there's a smaller chance of anything significant happening. The front of the skull is very thick, and so it's unlikely that any serious injury is going to happen from a regular fall a child will take, even out of a crib. The side of the skull is a lot thinner, and that's where Natasha Richardson, when she hit her head, that's the side of the brain that got affected, is because on the side you can even feel it. It's very thin. Anyone who's into like martial arts or mixed martial arts, the forehead can be used as a weapon. That's how thick it is. You can headbutt someone, but that doesn't apply to the sides of your head as well. So those are just kind of points that you can use. If your kid's running and hits his forehead, more than likely nothing's going to happen. But side of the head, I even a little bit more concerned about that because the bone is a lot thinner on there.
And you bring up a question I have is because I have the personality. I want to know worst case scenario right off the bat, but I know parents aren't like that. So when you have not even necessarily a child or a patient, when they come into your hospital and something's really bad, how do you address them? Do you, I mean, obviously you kind of build them up, but do you personally